लोग सरकार क्यों चुनते हैं सर? सरकार लोग चुनते हैं आसमानी बातों के लिए नहीं चुनते हैं। चाहे आप चुने गए या कभी ये चुने गए या कभी आप चुने ना जाएं, ये चुने जाएं, ये जो भी होगा ये तय है कि आसमानी मुद्दों के लिए आपका चयन नहीं होता है। आप सरकारें चुनी जाती हैं जो मौलिक चीजें हैं। क्या मौलिक हो सकता है जीवन से बेहतर और जीवन से उच्चतर?
Now bills for consideration and passing the Right to Health Bill 2021. Professor Manoj Jha to move a motion for consideration of the Right to Health Bill 2021.
सरकार के खुद के आंकड़ों के मुताबिक 2.25 लाख लोग कोविड के नाम से कोविड में काल कवलित हो गए। सर, मेरा अभी भी मानना है और आप में से अधिकांश लोग मानेंगे कि ये मौत सिर्फ महामारी से नहीं हुई, ये मौतें हुई हैं व्यवस्था के चरमराने से। शायद हमारी व्यवस्थाएं इतनी इलास्टिक, इतनी वाइड, उनका एम्बिट इतना विशाल नहीं था कि वो उस सब चीज को समाहित कर सके जिसने कोविड ने हमें एक चैलेंज के रूप में दिया था। सर, मैं एनएफएसएस का डेटा देख रहा था और वो डेटा हम सब के लिए चिंता का विषय होना चाहिए। किसी राज्य में किसी की सरकार है, केंद्र में किसी की सरकार है, और अक्सर हम इस बात को कह करके आंख मूंद लेते हैं कि स्वास्थ्य तो राज्य के क्षेत्र में है, राज्य का मामला है। सर नहीं, जीवन और मृत्यु हमारे संविधान के अंदर कितने आर्टिकल्स हैं जिसको लेकर के जीवन और मृत्यु के दृष्टिकोण में ये स्टेट, सेंटर और कंकरेंट की अवधारणा को त्यागना होगा। वो क्षण आज है। मैं दूसरी चीज कह रहा था कि जीने का अधिकार की जब हम बात करते हैं, राइट टू लाइफ, एंड विच इज अ फंडामेंटल राइट, how do we address that right to life issue unless we have the corresponding rights available? And what are those corresponding rights? Right to health.
But I would say that right to health is already a fundamental right. It's already an inalienable right, and this has been pronounced by the Honorable Supreme Court as late as July 2020, and it has said that the duty of the state to ensure the right to health. There is no point having another act when the basic thing of supply and distribution is not addressed. You have to supply and not even stop at that. You have to distribute those. Now I'll come to another structural defect in the bill, I thought, and that is the bill at section 5, clause 5, mentions right to food, right to water, right to sanitation, right to therapy, right to healthcare services, right to road safety, right to occupational safety, protection. Now, everything is already covered under separate legislations. Bringing in more legislation, more act provisions will not really solve the problem. The problem, which I completely agree with the sentiments expressed on both the sides, is that health is an issue in this country. Health has remained to be an issue since independence, and that is because the resources available in this country for generating this kind of health infrastructure, both physical and human resources, has not been available.
It is true that the Supreme Court had given the judgment, hence there is no need for bill according to you. But yet, we have not passed the legislation at all. The states have not taken cognizance of what Supreme Court has said. What Supreme Court said, the states have not taken. We are not under the para 3 of the Constitution. Still, it continues to be state subject. Therefore, a bill like this, if it makes it a fundamental right and brings under para 3, then there is a scope for the states to step in.
I think many of us agree on this subject that the right to life, as mentioned by many members here, that Article 21 says right to life includes right to health. But I think we need to make a distinction. We need to provide more emphasis to the right to health, because without that, the entire country is suffering. Sir, unfortunately, the current healthcare system in India reflects an economic and a social gap in accessing quality health care and draws attention to further measures that are required to be taken by the central government to assure health to all its citizens. And it's very simple. The way the Right to Education Act was brought, providing free and compulsory education to all the children of the country, in the same way the right to health must be brought. If this bill is not accepted, the government must come in with a bill which gives free and provides free health care to all the citizens of India, irrespective of their class, their economic status, or whatever.
Today, the allocation is 1.4% of the GDP as far as the budget of the center is concerned. And even the economic survey wanted it to be 2.5 to 3, which I personally feel is wrong. It should be 6% as far as education and medical is concerned. Because these are the two things which should be the concern of the state governments. They are the concern of the government. The other things do follow, and the people themselves will take it up. But these two things that people can't take themselves.
Ma'am, our emphasis in policy has always been on outputs, not on outcomes. And that is the biggest bane. When we are talking about setting up hospitals, we say we have set up hospitals without doctors. We have set up hospitals without paramedic staff. We have set up hospitals without nurses. Now that is why it is important to emphasize only on outcomes. Let outcomes be the criteria of all our policies, particularly health.
Many of my colleagues have mentioned that the expenditure on health is only 1.6% of the gross domestic product. And Yes, 1.4. And my honorable colleague, Mr. Keshava Rao, also has said that it should be at least 6%. I agree with him that we need to increase expenditure on health, because unless it is done, we cannot provide the huge population of India the relief from the ails that they go through. Sir, out-of-pocket payments are the predominant mode for financing healthcare in the country. This is grossly unfair and exposes a large number of households to catastrophic health expenditure, which has often been a contributing factor for rural and urban indebtedness, as mentioned earlier by my colleagues.
As the Finance Commission says that 14% of the people, borrow money to go to the hospital. And every year, 6 crore people are plunged into poverty because they approached hospitals for their health needs. Sir, we have to think about this. We are pushing the people to poverty because they have nowhere to go to fulfill their health needs. We need to consider this as the fundamental right.
मैं उस राज्य से आता हूं जहां कहने को एम्स है, नए बने हैं, लेकिन आप अभी चले जाइए दिल्ली के एम्स, गलियारे में बेड के इंतजार में हजारों लोग बिहार के आपको मिलेंगे, अंदर नहीं एंट्री हो पा रही है। ये क्यों हो रहा है? जब मेडिकल कारणों से पलायन होता है माननीय स्वास्थ्य मंत्री जी, तो एक पूरा घर मूव करता है, वो दिल्ली में आकर ठिकाना लेता है, किराए का मकान लेता है, रसोई का इंतजाम करता है, ठीक हो या ना हो उसकी जिंदगी खत्म हो जाती है, वो गरीबी में चला जाता है। This house must also urge the government, I mean the house, not individual parties or members, that the GDP we spend on health should be toned up. It should go high. स्वास्थ्य और शिक्षा से बेहतर आपके पास कोई न उपकरण है, न चुनौती है, न प्राथमिकता है। अगर ये हम आप सबके बीच में स्वीकार्य है, तो हमारी जीडीपी का एक बड़ा हिस्सा वहां खर्च होना चाहिए। ये जो इंश्योरेंस मॉडल है, इस पर भी माननीय मंत्री महोदय पुनर्विचार होना चाहिए। दिस इंश्योरेंस मॉडल ऑफ हेल्थ केयर इज एक्चुअली हेवीली टिल्टेड इन फेवर ऑफ द इंश्योरेंस कंपनीज। इंश्योरेंस कंपनीज का बहुत फायदा हो रहा है, मैं मानता हूं। अगर हमारी चिंता इंश्योरेंस कंपनीज को पुष्पित पल्लवित करने में है, तो जाहिर तौर पर आप करिए जो आप कर रहे हैं। लेकिन अगर आपकी चिंता 140 करोड़ हिंदुस्तानी नागरिकों में है, तो आप इंश्योरेंस मॉडल को रिविजिट करिए। मैं इसको खारिज करने की बात नहीं कर रहा हूं। विजिट हैव मल्टीपल स्ट्रेटा, डिफरेंट स्ट्रेटा शुड हैव अ डिफरेंट काइंड ऑफ अरेंजमेंट। अगर हम वो कर पाएंगे तो शायद बेहतर कर पाएंगे। तो जब मैं मौलिक अधिकार के अंदर लाने की बात कर रहा हूं तो उसके बारे में एक स्पष्ट दृष्टिकोण ये है कि एक बार अगर हमने स्वास्थ्य को जीवन का अधिकार के साथ जोड़ते हुए मौलिक अधिकार में ले लिया तो मैं नहीं समझता हूं कि बाजार के कोई रॉन्ग प्लेयर हों या कोई रॉन्गफुल चीजें होंगी। हमारे पास पुख्ता व्यवस्थाएं होंगी।